My name is Geissler. I'm a patient advocate and co-founder of a number of cancer patient organizations across Europe. And with me on as co-moderators, I'm very happy to have Gilles Frydman from ACOR and Chris Flim from the Dutch Association for eHealth. And for us patients, it's very important to have fresh thinking and innovation. That's why I'm very glad we have this session with presentations of 8 startups, 5 minutes each to pitch their idea.
Hello, so I'm Henrik Gizet from VoxMed. We are supporting the startup forum, the startup here session, as we really believe that innovation comes from startups. We are a US-based company. We strongly believe in startups and the power of innovation coming from, I would say, grassroots innovations. We also would love to see some investment being made either from public or private sector in startups, and strongly believing that the future of social media is currently written by startups.
Alerte Fièvre is a smartphone application created by a French doctor, validated by international pediatricians, and it's based on international guidelines. So in practice, what does it mean? You take into account the weight, age, medical history, and of course the fever itself, the value to tell people whether they should take a medication, what dosage, whether they need to get in touch with a doctor, where to find one, or whether they have to call the emergency services. And of course, we also monitor this. We tell them when they should measure temperature again and repeat drug administration. So it's fairly basic. This is the screen. The temperature is measured. You do this by moving a cursor. You validate the date, and you fill in your profile with your name, birth date, weight.
La création du profil ici,
et on a comme autre information, on peut rencontrer un médecin, on peut mettre un autre contact, qui sera par exemple l'autre parent, si on a affaire à un enfant, de manière à pouvoir le prévenir. Tout de suite, dès qu'on a rentré cette température, on a 3 types de recommandations qui apparaissent. Des conseils d'ordre généraux, les réponses aux questions concernant le médicament et concernant l'appel médical. Si on rentre dans le détail, eh bien, on a des conseils d'ordre généraux qui peuvent paraître banaux, mais qui, je vous le promets, sont très utiles pour tout un chacun et qui sont, bien sûr, vont dépendre et du niveau de température et de l'âge.
What is Diagnosia? Diagnosia is a drug search, the first pan-European drug search. It's freely available to anyone. And I think it's a great service. Think about the following situation, a situation that I've been in repeatedly as a physician in the hospital. You accept the patient, it's 2 o'clock in the morning, you sit there, you're looking at the drugs that the patient takes. The patient maybe doesn't come from your country, but is from, I don't know, some neighboring country, uses some drugs that you don't know. You try to look them up online, and what you find is a forum. And you get patients discussing the drug, and that's what usually comes up first in Google. It's not very useful on a professional basis. So I'm really happy that they're actually doing this very cool project. They got the patient leaflets and the doctor's information from the agencies like EMA and the national agencies. Right now they have 4 languages, which are, I think, German, English, Spanish, and French. And it really gives you all the information you need about a drug, meaning indications, side effects, and so forth. These informations are really freely available from the agencies. The problem is that they are in PDF format, and non-searchable PDFs for that matter, which makes them really non-existent for Google. And they have developed a technology that actually parses this information and puts it into HTML format.
Thank you and good afternoon. I'm going to use my iPad because I have a lot of information about DocPons, and I just simply don't want to forget to tell you something that's quite important about this new and innovative company. DocPons is the first of its kind in the U.S. and certainly in the world, delivering outpatient healthcare services to those that would not otherwise have access. So those are uninsured people, underinsured people with catastrophic plans with very high deductibles or capitation insurance policies. So essentially, DocPons is for anyone. This is a screenshot of our homepage that will be coming online quite soon. But DocPons is a US-based online healthcare company providing access to quality outpatient healthcare to the uninsured, underinsured, and to persons with capitation and, again, our catastrophic insurance plans. Okay, thank you. DocPons utilizes the discount coupon model that's been made popular by social networking sites like Groupon or Living Social, if you're familiar with that in the United States. Essentially, DocPons provides healthcare to everyone, making healthcare a right and not a privilege of just the wealthy. DocPons removes essentially all barriers to receiving outpatient healthcare services. DocPons works when allied healthcare providers feature their practice on our official DocPons website. Featuring a healthcare service on DocPons is free, and subscribing to DocPons to receive these outpatient offers is also free. Subscribers are asked limited demographic information, including their email address, age, gender, zip code, and they're asked to select the type of offers that they would like to receive from DocPons. It's very, very simple.
Well, I come from Spain, as my accent says. Doctoralia is a company founded and based in Barcelona. In the beginning, we were focused in trying to approach the patients to doctors. And in the beginning, we were doing things like this. This is a medical directory. The things worked quite well. So well that we thought that this problem that we had in Spain probably could be the same in other countries, and we are now in 15 countries giving information to patients. Then, as we are very smart boys, tried to check if all the information that we were serving to our patients or the patients that were looking for information in Google was right. So we just made phone calls to the cabinets, to the medical centers, to the doctors that we had. Then, surprisingly, we had a surprise. We noticed that one of each 4 calls that we made were lost. Nobody was on the other side of the line. Then we thought here an opportunity, and then we have developed 6 months ago the possibility to make online appointments. This is not a disruptive technology. It's something that is in other industries, is in traveling, is in hotels. But we thought that it was a good opportunity, and for the moment, we have having good results. In Barcelona, we have about 700. In 6 months, we have published 700 agendas of doctors and hospitals in Madrid, Barcelona, and other cities where doctors have wanted to open them. We would like to extend this model to other countries where we're important. And our main point is that in the beginning we have got the patients. There are many patients looking for us. We have about 4 million monthly users in our 15 countries.
We're very excited to be here today because today really is our beginning. We released a version at the end of last year, which we've now iterated a few times. And in April, kind of beginning of May time, we released the version that we now have, which is MedCrowd. So for us, this really is the beginning. MedCrowd is used by people working in healthcare to solve the problems they face at work. It's a problem-solving tool that harnesses the power of the crowd to solve healthcare's problems. Because we're so new, we've only got a few hundred members at the moment, but we're getting more every single week, and hopefully we'll have thousands soon. You can see that our membership is very broad. We're open to healthcare professionals, healthcare organizations, so expert patients who might be working for charities, not-for-profit groups, but we're also open to the healthcare industry, so pharmaceutical companies and device manufacturers. so anybody who's working in healthcare. You can see here how it works. You just share a problem. It goes here into the most recent feed, and people can look at that problem and give their opinions. Here's an example of a problem, a straightforward, complex patient. Most of our problems have been shared by healthcare professionals who need help trying to find the best approach for their patient. And you can see that down the bottom you've got voting buttons where you can help, the crowd can help find the best opinion so that the problem sharer can very quickly find the best solution for their problem.
Hello, everybody. My name's Zinaggl. I'm the founder of Medico.com, and it's a real pleasure to be here in the company of so many people working on similar problems and technologies. It's really fascinating for me. Let me tell you a little bit about how I came up with the idea for this company. At my last position, I was working at Google. I was at Google for about 6.5 years. And the last job I had there, I was running product management for Google in Africa, the Middle East, and in Eastern Europe. And doing this, I had to travel in all these countries and learn about the state of the internet in all these countries and see what Google should be doing, what products Google should launch, how we could help the startup ecosystem in these markets, if we should buy companies, things like that. And one of the things I noticed was that there was a real lack of high quality and reliable healthcare information in these markets. Not just high quality information that's targeted there, but very specifically locally relevant information. And as you guys probably know, healthcare information is partly, this scientific sort of reference information, but a lot of it is how to deal with a condition, how to deal with an illness, how to help people, diet, and things like that. And these are very, very specific to different markets. So the idea behind the company was to see if we could set up a platform where we could provide this high-quality information to multiple countries. The company was founded last year in October, and our site, our first site in Spanish, has been up for about a month now, targeting Spain and Latin America. So I often get the question of, well, isn't health the same anywhere? Isn't a broken arm the same broken arm anywhere? But the fact is, as I mentioned earlier, treating a condition is very specific to the culture and to the country that you're in. So these are some examples of questions that we've gotten. And the answers are very different depending on what country you're in. So, for example, people are asking us, asking the site, I have diabetes type 2, I live in India, what should I be eating? And the answer to that will be very different to the answer you'd give to somebody who lives in Spain or in Argentina, for example, or the United States.
Hello, everyone. So my name is Jean-Denis Koeck, and I'm here to talk to you about MesVaccins.net, a French website featuring a smart electronic immunization record. So today, immunization is becoming an increasingly complex issue, as especially in France, vaccination has to be tailored to the needs of each patient, which means in practice that the doctor, when deciding whether to vaccinate or not his patient, has to take into account not only the age and the gender of the patient, but a whole range of medical conditions, of which we counted more than 400, and he has to take into account travel plans. So my father, Jean-Louis Koeck, is a doctor and an immunization expert, and he quickly realized that this problem could be solved or at least alleviated by the use of modern information technologies. So with our non-profit-based, non-profit research organization in Bordeaux, we set out to develop websites that help patients as well as health professionals in their immunization practices. So here is the homepage of our website, main website, MesVaccins.net. So the use case is simple. You type in your age, your gender, you're presented with a form and several medical conditions. You check a few of them, and you get a report telling you when you should be vaccinated against which disease and why and when. So we also developed MedicineDesVoyages.net. It's a similar website, but featuring travel advice, taking into account your foreign country and the length of your stay.
So hello everybody, so thanks for the invitation. So I'm representing Withings. Withings is a French company. What we do is we try to develop, in fact, Health 2.0 hardware. We speak a lot about software services. Our view is that it starts at the patient's side and home, and it starts with a body sensor. So we develop a connected version of existing body sensors. Why we think it's a good idea to connect body sensors? For two reasons, two very simple reasons. First, we think that we can make the device simple to use by connecting it to the internet. And I think it's the most important thing. We talk a lot about stickiness to a protocol, adherence to tracking some parameters over the long term. The most important way to do it is that there is no protocol, that it's completely embedded in your everyday life, and we think we can do it by connecting it to the internet. The second reason is that we hope to enrich services provided by these products to the user by connecting them. So I hope I will show it to you with our new babies. Our product is a blood pressure monitor. We are demonstrating it next door, so I hope you will pass by. The idea is simple, is to use the mobile phone, here an iPhone, as a screen and button of the blood pressure monitor. So why we do it is, you know, when you need to track your blood pressure at home, what the doctor will ask you is to take your blood pressure from time to time, regularly, over a long period, write down the result, sometimes make an average, write down everything, and give it back to the doctors when you go back at your next session. Everything that I've said after taking a measurement is done automatically by using our device. So just by taking your measure from time to time, it will be recorded, graphs, and shared with your doctor automatically. And so we are very happy and proud to announce that we've just launched this product in the US because we just got the FDA approval. So it's not a gadget, it's a medical device for home use.
Welcome to What's for Health, Google style. It's a young company, young startup. We are based in Chino, California. We have a team and partners in France, the SysMeth team in Rouen, and a team as Innova Technologies in India, as you see below. So What's for Health, it's a search engine, a medical search engine, and I will try to prove you that it's unique and it's very innovative. As you could see above in the search on the Medline, I think all the physicians know about PubMed and Medline. If I'm looking at kidney cancer, you will see that, there is music also, you will see that the search engine is making a terminological expansion. You see kidney neoplasm, renal neoplasm, neoplasia. So when you put simple keywords like kidney cancer, you will miss any paper, any lasting peer-reviewed journal. So if you are researchers, if you are physicians, even if you are a patient, you get to the largest medical database in the world.
So Giovanna Marsico, I'm from CancerCampus in France. We are not very far from here, we are in Villejuif, and we are really delighted and honored to present our platform for helping cancer community, online cancer community, in such this conference. And we are really excited because this is the very first time that we unveil the name and the identity of this French web lab, which is destined to promote collaboratory intelligence for cancer care. And the aim of the platform is to develop or to provide to develop participatory guidelines and to change attitudes, to change laws and practices. So this thanks to the implication of different actors such as patients, professionals, associations, politicians, and in general civil society. So we are really, really, we appreciate the opportunity to be here because our work will be better known and more quickly from more patients and professionals, thanks to you bloggers and journalists, and thank especially of Denise and her staff. So you can enjoy our short video, and you can make me questions after all at the cocktail. So ladies and gentlemen, you have cancer contribution.
I think we had great impressions from that session, from different startups, innovation, new thoughts. We had a couple of comments on Twitter as well. We'd like to open the floor now to the audience to have discussion questions to the contestants, to the panel, whatever you like.
I must say that I followed the discussion in the former session as well on the Gartner hype cycle. Because the question on business models is not so easy to answer. I think for one thing is that creativity is very important, and looking beyond healthcare, but looking at health and looking at other parties who might be interested in health of, for example, citizens or employees might be an interesting thing. The other thing on business models is, as our own chairman of the Doctors Association, Eric Frydman, said, sometimes coming down to real basic things. It's for one thing, time and time saving and added value for doctors, because I believe, that's my personal opinion, that many of the services should not only support citizens or patients, but doctors as well, and especially the communication between them. And therefore, one of the challenges we have is time. Another thing, and it may be a bit down to earth, but it comes to what was mentioned from the European Union, and Mr. Frydman mentioned it yesterday as well. He likes to send emails to his patients as a doctor, but the main effort he makes is to retype all he has discussed with his patients into the electronic health records. So although Health 2.0 may be a brave new world, it has to connect some way or the other to the traditional systems.
Improved e-health or empowerment health brings benefits in terms of cost to the system. But in Europe, let's face it, we're looking at two situations. Either a system that's cracking at the seams like the French system, or a system that's rationing care like the British system, in the two extremes. So my question really to you is, in all of the e-health debate, is there a risk, and this is where I'm bouncing off Giovanna's presentation, because it would be very interesting to hear what you did at, I'm assuming it's Gustave Roussy, this institute, the Cancer Institute where you did this, the payers, and this is the French government, because I looked at the video that you did and you had all of the stakeholders in there, and when you look at, for example, there's an interesting study that was done about, I think it was 3 months ago, compared market access for cancer drugs in the United States versus market access for cancer drugs in Europe. I think from memory, and please bear with me if I'm wrong, the US was about 9 months, Europe was anything between 15 and 18 months. What you're doing, part of it that I saw on the screen, was looking at protocols, treatment protocols. Now that's going to have an impact on lobbying, which arguably will have an impact on market access, which will have an impact on health budgets. So I'm curious as to, in all of this empowerment debate and e-debate and pushing the patient to the centre, has anyone bothered to ask the question about budgets, be it private insurers, be it public insurers, be it the individual who actually has to pay out of their own pocket. Just a comment that I just wanted to ask a question, particularly in your case, because I can only imagine to do what you've done, you've had to reach out to the payers, the French authorities, and say, this is what I do, because there is a good chance, and I mean that sincerely, a good chance that you will push the French authorities to accelerate protocols and improve market access for cancer patients.
Well, I hear from your question. The point is, Cancer Contribution is a platform which is made from the Pôle Citoyen of CancerCampus. So, l'Institut Gustave Roussy is a partner of the big project CancerCampus, but the big project CancerCampus is supported especially from local collectivities, from local government. So the aim for us is really to associate different actors, such as hospitals, such as politicians, political system, and patients, and create a sort of panel, permanent panel, in order to bring evolution towards new practices. So there is no more Gustave Roussy behind us. Gustave Roussy is an indirect member of the project. Well, that's for my case.
So I have to follow up. So earlier at the panel where Giovanna was, there was, I think, a representative of the French government or a French agency who very smartly said that all the civilized countries have systems like France. So I come from an uncivilized country. I come from the US, where the healthcare system is not at all run by the government. And uncivilized systems are sometimes very smart. They look into the cost of care. And your question really is fundamental. It's a fundamental question about all e-health. And we are starting to learn more and more that informed and empowered patients, in fact, are the best way to lower the cost. There are more and more studies coming, like more and more regularly. There was one that came just a week ago, really a fundamental study showing that it's a Harvard school study on end-of-life care, showing that in a hospital where you inform the end-of-life patients, the readmission drops by 25%. And lowers the cost, I mean, really tremendously.
I'd also like to add to that from a patient perspective. I mean, there's always the notion, and some use that as a political argument, that empowerment of patient increases costs because they're just all asking for more drugs, which is actually not true, because patients don't have an interest in waste of resources, in duplicative diagnostics, in taking the wrong therapies, because they know they're going to relapse or suffer if they're getting the wrong treatment. So my experience is that patients are usually, or patient advocacy groups are usually focused on more efficacy and less waste. And I think what we're talking in e-health as well is improving efficacy by empowering patients that they understand what they're getting and probably going to the doctor that's treating them right, and probably getting the treatment that is probably best for their situation and so on. So we're not talking about increasing costs, we're talking about making more efficacious. And I think that's the main argument for doing it from both sides.
Maybe a comment from me as well. That's one thing when I mentioned creativity in business models. But there's one other thing, and I must agree, in the Netherlands we have the discussion as well, talking about e-health or in more general sense, innovation. From one point, the internet is there, so these things are happening. But I must admit that there's a debate going on in the Netherlands that if you do all these new things and not stop doing old things, you get extra things. So there is a debate indeed, what traditional healthcare processes, what traditional ways of working you will not do anymore. So what will you change? And if you don't do that, then you may run the risk that some of the startups here as well may be an extra to what you already have. So I agree that there's a budget issue, but I also agree that there's a budget issue that if we don't do nothing, that the cost will continue to rise. And if we don't let the patient help and introduce these new ways of working, we will have a problem nonetheless. So we need solutions, I think.
if there are no further questions, I think we're going to wrap up the session. Like someone was writing, I couldn't read the name, don't forget to vote. It's very important that you vote for the startups.